Hi beautiful people, good afternoon and welcome back to my YouTube channel. By the way, today is Sunday. Happy Sunday. In case you're coming across my face for the first time, I'm a mom of 4 triplets and I got pregnant with them through the help of IVF. By the way, I've been meaning to say something and I need to say it now before I dive right into the video. I don't see the reason why you guys will request for a video. Then after making the video, you will find it difficult for you to just like the video or even comment. At least all those likes and comments will show that, oh, you're actually trying. We appreciate what you do. But up to 1K people might even watch your video and you'll be getting like 5 likes, 10 likes. It's not nice. It's not nice. Like it discourages me from making videos. But regardless, I'll keep doing what I do. So today we'll be talking about tips for IVF success and pregnancy. A lot of things can be a hindrance to your IVF. By the way, a lot of people come to the comment section to ask, what is IVF? IVF is just an in vitro fertilization. It's a situation whereby they stimulate your eggs with medications, bring them out, and then mix it with your husband's sperm, fertilize the both of them in the lab, and then put it back for the woman when her womb is fully ready to carry it. So that is what IVF is in a layman's term. So there are so many things that can hinder your IVF success, and there are so many things that can equally boost it, like to make you have a successful embryo transfer. So many people do IVF once and then they get pregnant. There are some other people do twice, 3 times, 4 times, and most of them end up not working no matter how many times you've done it. So for the for you to at least maximize your chances of getting your positive result, there are some certain things you should do, even though at the end of the day God has the final say, but at least you should do your own part. The first thing I'll be talking about is for you to pick the right doctor and hospital. It is very necessary. I'm not saying you should go about asking someone, oh, where did you do your own? Oh, because you did there, that is where I will do. Because you did there, that's where I will do. No. Sometimes if you get to that hospital where maybe you've asked around and they say it is good, when you get there and you feel like, oh, your spirit does not accept there, do not do it there. Because the fact that other people's own worked for them does not mean your own will work for you. Make sure you are at peace with the environment of the hospital. It's not about maybe aesthetic or whatsoever. Just be at peace with the hospital, with your doctor. Very, very important. Most times you will go to a hospital and show yourself. All the nurses don't really carry you for mind that this woman is a troublemaker. This woman is this woman too asks questions. This woman did this, this woman did that. Choose the right doctor, choose the right hospital. It will do you a lot of favor. Any hospital you are going for your IVF, make sure they are good at what they do. I do not say you should go there and start checking environment. Environment is good, but you're not sleeping at the hospital at the end of the day. Just make the right decision by asking the necessary questions you need to ask. If you know people that did there, you can equally ask them, oh, how is this doctor? And I believe that there are hospitals, there are doctors that they try their best to, be friendly to their patients. Green care is one of those places. I'm not saying that everybody's there is going to be perfect. Obviously, somebody that I might even find amazing, you might say that that person is too strict, that person is this, that person is that. Work with whatever works for you, whoever you feel like it's okay for you, work with that person. So that is it. The number one thing I just mentioned, pick the right doctor and the right hospital. The second thing on my list is, what is your protocol? When it comes to your protocol, you should consider your age, your AMH, your history. Some people, they'll go for an IVF and then they'll say, oh, put 10 for me because someone else put 10. Oh, put 5 for me because your neighbor put 5. Oh, put 100 for me because your neighbor put 100. Your age and your neighbor's age is not the same. You just have to work with what works for your body, what works for your age, what is good for your age. Most people in their 30s, in their 20s, the number of embryo they put for them is not what they will put for someone in her 50s, in her 60s. You understand? So you just have to, work with your age. The next thing is your AMH. Most people have low AMH. When you've seen yourself in that situation that, oh, your AMH is low and then the hospital advise you to go for a donor egg, don't say no. My neighbor or my friend, she did not use donor egg. That your neighbor might not have issues of AMH. She does not have PCOS. Maybe you now you have PCOS, or you have one thing that depreciated your eggs, or or you have come of age and then your AMH has gone low and all those things. Please allow them to work with your body. What works for you. Do not compare yourself with somebody else. Allow the hospital to do what they know how to do best. Allow them to work with your age. Don't go and teach them their job. So the next thing is history. Most people in their lineage, pregnancy used to show them shaggy. Pregnancy used to do this to them, especially maybe when they're carrying twins, when they are this, when they are that, they have diabetes, they have like one thing. You need to be fully certified, like everything should be okay with you before you choose your IVF. Don't say, oh, somebody else did this one did that, this one did that, for that I'm going to do it, for that I'm going to do it. No, do what works for you. Allow what works for other people. Just focus on yourself alone. The third thing I'll be mentioning, what is your goal? What is your goal in the sense that how many children do you want to have? How many kids do you wish to have? Conclude within you first before going for that IVF process. Conclude within you how many children you want. Hmm? Don't say, oh, that my friend, they put 5 for her, 2 stayed, 10 stayed, 4 stayed, 3 stayed. Conclude within you how many you want. Then go to that hospital that you've selected for yourself. Tell the hospital, oh, this is my goal. This is my goal. It's now left for them to work with your body and see if you'll be able to do what you just want for yourself. You should already know how many children you want to have. Even if maybe at the end of the day, the IVF does not give you the perfect number of children you want, but at least have it within you, oh, this is what I want. And so that when you get there and then you tell them, this is what I want, this is the number of children I want for myself, they should be in the best position to tell you, oh, okay, it's fine. Because most people will go there and say, oh, I want triplets, I want quadruplets, whereas you know you are in your 40s. You will not be able to carry it, sure you know. Even if you end up, even if they even put 2 for you and maybe the 2 splitted and turn to 3 or 4, you should know it will be a problem to you. That's why most people that have come of age and then maybe their embryo splitted and they had multiple babies, they will have to reduce, they will do embryo reduction for you. Yes, they will have to do embryo, or even if they don't do embryo reduction, there is a particular weeks you will carry that pregnancy and then they will just bring out the children, put in the incubator for your sake and for the sake of the babies. You understand? So you should have a goal before planning your IVF, that this is what I want. This is what I want. Like, have a covenant with God. Let me just put it that way. Have a covenant with God. Tell God what you want and then allow every other thing to unfold on its own. Okay. The fourth thing I'll be mentioning is be prepared for your embryo transfer. After egg stimulation, collection of eggs, mixing it with your husband's sperm, and then some people go ahead to freeze. Maybe they are not ready to do the transfer. Maybe their body is not yet okay. Maybe your womb has not gotten to the certain way or level they want it to be before they can do the transfer for you. Yeah, there are so many challenges that you might have along the line that will make you freeze your egg. Some other people, they just choose to freeze it, not like they have any problem. But before you do your embryo transfer, you should prepare your body, you should prepare your mind, in the sense that if they say you should do hysteroscopy is one of the things to you do to maximize the chances of embryo implantation. When you do hysteroscopy, at least it helps them have a clearer view of what is going on in your womb. Without hysteroscopy, there is no way they will know. Maybe most people have polyps. If they don't do it, they wouldn't know you have polyps. And polyps is one of the things that chop pregnancy, like say tomorrow, no day. You understand? Most people have fibroid inside their womb, even without knowing. So you have to do hysteroscopy in order to prepare your body, in order to prepare your womb before your embryo transfer. Most people just do the egg collection, egg retrieval, mix it with your husband's sperm, freeze it, and then go for their hysteroscopy. Whereas most people who do fresh transfers, they do their hysteroscopy before egg collection and then mix it with their husband's sperm before putting it back for them. Then another thing is thyroid. Thyroid is another thing they consider before doing your embryo transfer, especially for people doing a frozen embryo transfer. By the time they have collected your eggs, mixed with your husband's sperm, freeze it, they will check your thyroid. A friend of mine called me the other day and said the hospital said they will check her thyroid. She will do a thyroid test. If it comes back fine, she will do her transfer. If it does not come back fine, I think they will have to do something about it before doing her embryo transfer. So I'm just trying to tell you the necessary things they need to consider that will help you maximize the chances of embryo implantation. The next thing is diabetes. Yes, most people have diabetes without even knowing. See, let me tell you, a lot of things is going on in our body that we don't even know, like we cannot even explain. But I think the hospital knows better. So, in case maybe the hospital is delaying to do your transfer, because most people don't even understand what's going on. They will be like, oh, this my transfer is already taking time. This one is already taking time. I started my procedure 5 months ago, and I'm here to do transfer. See, the hospital knows the best thing for you. They are trying to make sure they prepare your body. It's not just to just do sharp, 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 transfer embryo, and then at the end of the day you come back unsuccessful. The goal is for you to test positive at the end of the day, even if it takes 1 year for you to do your transfer. You are making me talk too much, but my only problem is that you end up not liking this video. That's the only problem I have with people, but no problem. So allow the hospital to do their work. You understand? They know better, they know best. So the last on my list is your lifestyle. Your lifestyle, in the sense that you will check what you eat, your fruit, avoid processed food, take your supplements like folic acid, prenatals. See, all these things, let me tell you, before you even take one of them, please consult your doctor. Like I usually say, I am not a doctor, I am not a nurse, I am nothing related to medical field. I know why I keep repeating this, so that tomorrow somebody will not come and say, Mom of what replace said. I did not say anything. I did not say anything. I'm only sharing my experience with women who are going through IVF procedure, because I feel like, or maybe because I've gone through IVF procedure, I can, tell you one or two things that I experienced during my own time. You understand? The hospital might not really tell you everything you need to know. Your lifestyle, the food you eat, your diet. I'll make a separate video about the food that I ate during my 2 weeks wait, because that video is long overdue. Like a lot of people have been asking me countless times the food that I ate, the food that I ate. Not like I ate too much, but I can just list them for you, in a separate video. This video is already too long. So your lifestyle, your food, your diet, your like everything basically. So I think when you try to put one or two of these things that I mentioned, into practice, it will help maximize your chances of a successful embryo implantation. Yeah, and then with the help of God, everything will go as planned. I'm wishing you all the best in your embryo transfer. You will come back successful, and we'll give all the glory to God. So I'll see you guys in my next video. Please, if up until now you've not subscribed to my channel, please do where to subscribe, like, comment, share, and I'll see you all in my next video. Bye.